Cal OSHA's mission is to protect California workers from occupational safety and health hazards. To address the hazards from COVID-19 infection, Cal OSHA adopted COVID-19 Prevention Emergency Temporary Standards. California employers and workers physically distanced, wore face coverings, washed their hands more frequently, cleaned and disinfected, and started getting vaccinated. The emergency standards were revised and readopted on June 17, 2021. This video provides an overview of many of these changes, requirements, and current recommendations. Keep in mind that these are the minimum requirements. Local health departments or the California Department of Public Health, or CDPH, may issue stricter requirements that employers must follow. In the revised standards, fully vaccinated employees are no longer required to wear face coverings except in certain situations, like during outbreaks and in settings where the employer requires them, or CDPH issues orders that require everyone to wear them. Currently, CDPH requires all individuals to wear face coverings, with limited exceptions, when on public transit and in transportation hubs, when indoors, in K-12 schools, child care and other youth settings, in healthcare settings, correctional facilities, detention centers, in homeless shelters, emergency shelters, and cooling centers. In addition to these requirements, and as a best practice, Cal OSHA encourages employers and workers to follow the recent update from the CDPH recommending that all individuals wear face coverings while indoors regardless of vaccination status. Cal OSHA requires unvaccinated employees working indoors or in a vehicle to wear a face covering. Exceptions are when an employee is alone in a room or vehicle, while eating or drinking at least 6 feet apart or outside, employees wearing respirators, employees who cannot wear face coverings due to a medical or mental health condition or disability, those who are hearing impaired or communicating with a hearing impaired person, or when an employee performs specific tasks which cannot be performed with a face covering. When working outdoors, employees do not need to wear face coverings, regardless of their vaccination status, except during outbreaks and when employers require them as a safety measure. Though face coverings are not usually required outdoors, employers must communicate to workers that face coverings are recommended for unvaccinated people outdoors where they cannot maintain 6 feet of physical distancing. Employers must provide face coverings to unvaccinated employees and make them available to vaccinated employees upon request. Employers must allow employees, regardless of their vaccination status, to wear face coverings without fear of retaliation. Employers need to document the vaccination status of their employees if they allow vaccinated employees to work without a face covering indoors, and must retain this information for a duration of time as required by Cal OSHA standards. Alternatively, instead of documenting vaccination status, employers can choose to treat all employees as though they are unvaccinated and require all employees to wear face coverings. For more information on the requirements, see Cal OSHA's COVID-19 FAQs. In addition, employees who are not fully vaccinated may request respirators, like an N95, for voluntary use from their employers at no cost and without fear of retaliation. Employers must provide the respirator along with basic information on how to properly use it so that it protects the user as designed. Employees are no longer required to physically distance from others except during major outbreaks and when the employer determines there is a hazard. Employers are required to assess workplace hazards and implement controls to prevent disease transmission on an ongoing basis. There may be circumstances where employers determine that physical distancing or barriers are necessary in their workplace. Nothing in the revised standards prevent employers from implementing measures that are more protective than the requirements. Employers must inform employees how they can participate in identifying COVID-19 hazards at work. Under the revised standards, employers must offer testing to unvaccinated employees who exhibit COVID-19 symptoms or who have had a close contact. They must also offer testing to vaccinated employees who develop COVID-19 symptoms after a close contact. Employers must establish, implement, and maintain effective written COVID-19 prevention protocols. The following are some of the requirements that must be included in writing. Identifying and evaluating employee exposures to COVID-19 health hazards, correcting unsafe and unhealthy conditions, maximizing air filtration and ventilation with outdoor air, training and instructing employees on how COVID-19 is spread, infection prevention techniques, and information regarding COVID-19 related benefits that affected employees may be entitled to under applicable laws. The training must also include information that particles containing the virus can travel more than 6 feet, especially indoors, and the methods to decrease the spread, including physical distancing, face coverings, increased ventilation indoors, and respiratory protection, are most effective when used in combination. Keeping employees out of the workplace when they test positive for COVID-19 regardless of vaccination status. Employees must also be excluded from the workplace if they have had close contact with others who are COVID-19 positive and are either not fully vaccinated or if they develop symptoms regardless of their vaccination status. Employers must continue to pay employees' wages if their close contact with others is work-related. It must also include procedures for contacting the local health department after learning of 3 or more COVID-19 cases at work to obtain guidance on preventing further spread of COVID-19 in their workplace, and maintaining accurate records and tracking all COVID-19 cases while ensuring medical information stays confidential. Employers must make non-confidential records available to employees, authorized employee representatives, and others as required by law, with personal identifying information removed. When an occupational COVID-19 related serious illness or death occurs, the employer must report it immediately to the nearest Cal OSHA Enforcement District office. This video only contains some highlights. Employers and employees should read the standards for full requirements. For those and more information, go to Cal OSHA's coronavirus webpage, www.dir.ca.gov/DOSH/coronavirus. Employees have the right to file a complaint with Cal OSHA if they feel their working conditions are not safe. They can find the contact information for the closest enforcement office by either checking the Cal OSHA poster that all employers must display or going to the Cal OSHA website. Employers can contact Cal OSHA Consultation for additional assistance. Contact information is on the Cal OSHA website. All these links are located below this video. Remember, COVID-19 continues to be a health hazard, but you can help protect yourself and others around you by following these simple steps. 1. Get vaccinated. Your free vaccine is waiting for you. Go to MyTurn.ca.gov to find a vaccination site. And 2. Wear a face covering if recommended or required. Your actions could save lives, including your own.